Welcome to my channel. I am Ovijit, and today in this video we are discussing about the basic anatomy of heart. I mean anatomy of human heart and the circulation of blood through the heart. All of the basic. So you are a student or aspirant or curious, you are in the right place. So let's grab your pen and let's get started. So to talking about the heart, just making a diagram of heart first. That's the first thing. And one more thing, that is our left side of heart. So it is our left side, it is our right side. For our that is our, we just take that is left or right as a left and left as a right. Okay, and make the diagram of heart. That is first our take is the ventricles, that is the left ventricle and that is the right ventricle. And left ventricle are pumping the blood all over the body, all over the body. And right ventricle pump the blood through um, blood in blood in lungs first. Okay, that is the pulmonary artery and that is the aorta. It's um, it flow the blood all over the body, and it from here, from the right ventricle, the blood flow to the first lungs, and from the left ventricle, blood flow all over the body by the aorta, and this is also by aorta. Okay. And one more thing, that is the system in the and by this by systematic circulation of blood flow. But first we will be talking about the anatomy, basic anatomy, that the structure of the heart first. That is the, and next we're talking about the this is fourth chamber, that is the ventricle, and the in upper, I mean the aorta, so artery, atrium, sorry, atrium and ventricle. That is the ventricle and atrium. And then she's talking about the walls of the heart. So the left ventricle's wall is much thi- uh, it is thicker because it pump the blood all of the body. That's why it's thicker, and it's less thicker because it just pump the blood only the lunch. That's why it's less thicker, and it's more thicker because it pump all over the body. And after that, it is the left atrium. It is the less thicker because it just pump blood from here to here, and that is our right atrium. It's thicker because it just blood from here to here. This is the less thicker, and its volume is greater from this. Okay, you just remember this. This volume is greater from there. This. Those actually questions come as a which atrium is bigger in size. That this is the right atrium is bigger in size. Okay, and right atrium and left atrium, in between there is a valve. Also in left atrium and left ventricle, there is also a valve. And in the aorta and the ventricle, left ventricle, there also a valve this. And here also the pulmonary artery and the right ventricle, there is also a valve. So this valve is called the bicas- bicuspid valve, and this valve is called tricuspid valve. Okay, this is tricuspid valve because of there is three. This is bicuspid because of this two gates are two gates. This is bicuspid, and this is the tricuspid three. The one, two, and three. Those three are opens. That's why the tricuspid. And just you just notice this is the I just arrow like arrow type this because blood flow in one sided. This blood from here to here only, and here this blood from here to here only, not the reverse. Because of the I don't want to the blood come to reverse. That's why our system is make like this. Okay. And after that, and one more things, and blood firstly come from there by the pulmonary vein, but blood first come from here by the pulmonary vein. This is the pulmonary vein and that is the pulmonary artery, and this blood come from here and there, by and then by the left ventricle all over the body by aorta. Okay. And here blood come from all over the body, from the our lower side of body and upper side of body. And this is the vena cava. This is our vena cava is the largest vein. Okay. This is the superior vena cava. Vena cava, and that is the inferior vena cava, and that is the vena cava. So, so first of all, eh, first of all, we just end the discuss of the structure of. So, sir, we just talking about the walls and the chambers, four chambers, and also the bulbs. Oh, this bulbs is called the because it is our artery and the ventricle. That is called artery valve, and that is the because of pulmonary is a pulmonary artery. That's why it's called the pulmonary valve. Okay, or sometimes it's called the semi-lunar valve because of their the valve are like moon half moon type structure, and also they are three. There's also three cuspid. Okay, and the semi-lunar, and all of these and this and this also three has three cuspid, but only this called as a tricuspid. Okay, so where am I? That's all about this. I think probably everything I say. Yes. And now I just talking about the circulation of blood. So how to start circulating the blood? So first of all, blood come from the lungs, lungs, but come from the pulmonary vein. That is pulmonary artery. Okay, that is pulmonary vein, and first pulmonary blood, the oxygenated blood. Okay, the pure blood, oxygenated blood come in the left atrium. Left atrium. After left atrium, it coming through the left ventricle. After that, and when the blood, oxygenated blood come here and full. Okay, then it come in the left ventricle. I mean, it contract, then the blood come here. Okay, after the blood come here, it's the valves are closed. Okay, and then the blood when the left ventricle are contract, then the blood goes through there. First, these left atrium are expand. Then the blood come from the lungs. Okay, then it is and this way it is spread all over the body with a systematic circulation. And when the right atrium is what's it contract, then the blood from all over the body, upper side and lower side, all of the blood come from here by this side, and here blood come here, and when it contract, then it come through here the right ventricles, and it also expanded when then comes, and when it fill with blood, then it is contract and blood flows through the lungs, here lungs and here lungs by this. Okay, that is the CO2 related, the impure blood. Okay, this is the oxygenated blood and the pure blood. Okay, so that's how the circulation happens. And both circulation happens at the same time. Okay, and so and those that's the basic circulation and anatomy of heart. That's the basic and circulation and anatomy of heart I just told you. And one more thing that is called um, fossa ovalis. That is the depression here found in the fossa ovalis. That is actually present in the embryo stage. Its name is foramen ovale, in the form of foramen ovale, and the aperture from these arteries to these arteries. Okay, in the embryo stage. After that, it will be uh, vanished. And this question appears in the railway board. That is a question as the where the fossa ovalis. I just fossa ovalis. Fossa ovalis. Fossa ovalis. Yes, that is the fossa ovalis. Okay, it found in right atrium. You just remember the fossa ovalis found at right atrium. Okay, and that's and one more thing. This are the walls. This was I mean, at the surrounded, surrounded by a membrane type membrane is called pericardial membrane. Okay, it's pericardial, pericardial. Peri means the outside. It is like the sac-like things. Just I mean, it is like catch the heart with the and it also prohibited the over expand of heart and expand but not over expand. Okay, this and the in the inside that is called the endocardium. This name is endocardium, the ender, the inside. This this skin is smooth, and this is make of endothelium tissues, make of endothelium tissue. That's why it is smooth, and blood flow is smooth, but that's why, because with no disturbance here. The heart made with this type of no disturbance needs here. So endo means the inner side, and in the middle is meso, that is myocardium. Okay, myocardium. Myo means muscles. Okay, that is the muscle of heart. Okay, and that is the septum. Okay, that is called the septum. This is the layer which separate the right side and left side. Okay, or septum. So that's, I think, everything I just clear. And one more thing, that is the SA node and AV node, for which the blood circulation, I mean, the heart systole and diastole. I just say about the contract and expand. When it contract, when it expand, all of blood come from body. This called systole. Okay, this is called systole. And the contraction, that is called systole. I just recheck. Uh, Contraction is called systole, and the contract is a systole, and there is a diastole. And the expand, and is called diastole, systole, diastole. And the blood pressure systole diastole is 120 by 80. I mean, when it contract, this pressure will be 120, and expand, it will be the 80. Okay, pressure for normal human beings. And 70 to 80 times per minute systole diastole. That's it. And anything, yes, the SA node and AV node. SA node are present here, and AV node are present here. It is the responsible for the contraction and expansion of heart. This makes a circulation expand the ability to contract and expand systole diastole. These the gives, and after that the atrium, and by this SA node and AV node. By SA node, by AV node, this is expand all of the heart. Okay, that's how happens, and that is only for body normally happens, and that's how. And if some any adrenaline or any nervous system just appear, then AV node also increase our the systole diastole in the heartbeat increase by the nervous system. So that's not a part. So here the I just summarize all of the thing. First, our heart is the fourth chamber, that is the left atrium, left ventricle, right ventricle, and right atrium. In between right atrium and left ventricle, that is the tricuspid valve present, and the left atrium and left ventricle, the bicuspid valve is present, and in left ventricle there is the aorta present, and between aorta and the left ventricle, that is the valve, semilunar valve, that is called the aortic valve is present, and the right ventricle and the pulmonary artery, between the right ventricle and pulmonary artery there is a valve present, that is called the pulmonary valve or the semilunar valve. Okay, so that is the main the anatomy of heart. And circulation, that is the first oxygen and the pure blood come from the lungs to the left atrium, then it goes to the left ventricle. After that, by the aorta it spread all over the body, and in this in right side, when it is expand, all of the blood come from the body upper side and lower side by the superior inferior vena cava. It come from the right atrium, and after that by tricuspid valve it come to the right ventricle, and after that from right ventricle to the pulmonary valve to the lungs for puring blood puring. So that's all about the circulation of blood. Hmm. And here the SC note and AV note for the contraction and the expand cessation. I mean systole and diastole for our heart. And another anything I miss? I don't think. And the walls, that is the at the that is the at the edge at the after the pericardium, that is the sac, that is they should protect our heart from the any for any mechanical or heart. Okay, harm, mechanical harm. That's why I just friction, it's prohibited the friction of heart with our body. Okay, and that is the and the, at the first the epicardium layer is present. After that myocardium, I just say myo means the muscles and cardium means the heart, and at the inside, that is called the endocardium. This is the by the endothelium tissues, that is a smooth, that's why the no disturbance occurs in when blood flow. Okay, the fully smooth blood flow occurs, and our blood flow is one directional. Okay, one directional. And one more thing, these valves are connected with this that's how connected with just erase those things, you can see properly. This is called teddy that this name is um, Cordy tendoni. Its name is Cordy tendoni in the tendoni, and is connected with the papillary muscles. Okay, name is Cordy tendoni and connected with papillary muscles. Okay, so you just remember that name is Cordy tendoni, like structure, and these are in the wall of the heart, papillary muscles. Okay, that's why you just open and do not and resist to over expand. Okay, So that's it for today's video. I just told everything about the heart and how the blood flow occurs and circulation of blood and the design of heart, how our heart actually looks like. The basic form I did not go in the much deeper, but I just saying to step by step everything. So if you think that is helpful for you, so well, say give a like and share with your friend. And if you have any suggestion or I have any mistakes, so give me comment. I had love to listen from you. So thank you for listening me. See you on next video.